I'm Marc de Pleural. I'm a thoracic surgeon at the Toronto General Hospital University Health Network on Princess Margaret Cancer Center. I specialize in surgery for mesothelioma.
My name is John Cho. I'm a radiation oncologist here at Princess Margaret Cancer Center. I work together with some of my colleagues, Dr. Marc de Pleural and Dr. Penny Bradbury in the Mesothelioma Lung Clinic.
Mesothelioma is a tumor of the lining of the lung that is related in the majority of the cases to asbestos. It is growing around the lung and progressively restricting the lung from functioning.
Our interest in meso in terms of research we've been doing for probably 15 years. So we are now on our third iteration of our SMART study. SMART stands for Surgery for Mesothelioma After Radiation Therapy, and it's a protocol that we've pioneered specifically here at Princess Margaret Hospital.
It was innovative in the sense that we use a combination of radiation and surgery.
We have a combination of short accelerated hemithoracic radiation performed over approximately 1 week, followed by surgery approximately a week afterwards.
The approach was innovative because of the use of the radiation before the surgery and because of the short course of the radiation. The number of patients who have been treated with the SMART approach is around 150.
Patients will get assessed and investigated by the various disciplines to make sure that they're fit for the variety of different treatments.
Typically, what we would recommend is that we see the majority of the patients with mesothelioma to decide on the best approach. And the final decision is based on a number of parameters that reflects the stage of the tumor, the condition of the patient, and increasingly the characteristic of the tumor. So the treatment and the decision is becoming more and more personalized.
The radiation treatment is a two-step process. The planning step requires that the patient have a planning scan, which is basically a therapeutic CT scan. Once that's done, and once we're satisfied that we have a feasible plan during that planning week, the patient will have 3 treatments given over 1 week. So often given alternate days. So for example, Monday, Wednesday, Friday. And then they will have a week gap, and then they will have the surgery.
The surgery for mesothelioma involves removing the tumor that is trapping the lung. There are 2 different types of surgery that can be done. One is to remove the tumor itself and preserve the lung. If the lung is not too infiltrated by the tumor, it is a possibility to recover the function of the lung to some degree. If the lung is largely involved by the tumor, occasionally to be more radical in terms of the surgery, we remove the tumor with the lung itself. The advantage of removing the lung is that the surgery may be more complete. It allows us to use a higher dose of radiation without putting the lung at risk, obviously. It does have some limitation, which is the ability for the patients to recover and to function with one lung. Typically, what we see with mesothelioma is that the lung that is affected by the tumor progressively becomes less and less functional, so patients start to be used to work with pretty much only one lung before the surgery, which functionally doesn't make a big difference.
How long does it take to recover really depends on the type of surgery that's performed. For the plectrum decortication, which is essentially removing the lining around the lung, the pleura, it can take up to 1 to 2 months. For the EPP, I would say between 2 to 3, depending on the overall fitness of the patient.
What we really want to ensure is that the patients have a long-term benefit or at least mid-term benefit from this approach, with the hope that it will last for several years.
The results we obtained through the SMART program actually have been quite encouraging. So the original SMART study demonstrated probably some of the best published results for a surgical series for mesothelioma.
In patients who have the best condition and the best markers, it can be 3 to 4 years or beyond that even. What we recommend to patients and to referring physicians is that pretty much all patients with mesothelioma should be referred to a center of excellence in order to review the situation of the patient and decide on the best treatment. The treatment for mesothelioma is evolving quite quickly in the sense that the treatment is becoming more personalized and the changes are starting to happen fast enough that patients will benefit from being referred to an expert centers in order to be able to have the optimal possibilities based on the up-to-date knowledge.
Often the patients will be referred to us because they were diagnosed with mesothelioma. The initial interviews are conducted usually in person, but sometimes we do it virtually. We prefer to see them locally just to be able to assess them, their overall physical fitness. But sometimes that can be a challenge because we also get referrals from across the country. So often we will have the first interview done remotely through Zoom or MS Teams. We believe the future is a continuation of what we're doing right now, as well as immunotherapy, and we think the immunotherapy will have an important role to play in the future studies and the future treatment of mesothelioma.
The hope with the SMART approach is to use that as a platform to achieve a cure.